whether it is via injection or insulin pump, and monitoring blood glucose. Be absolutely sure that your client can recognize the signs and symptoms of hypoglycemia and hyperglycemia. Maternal complications of gestational diabetes are hyperglycemia, dystocia, hydramnios, pregnancy-induced hypertension, urinary tract infections, postpartum infections, increased risk of stillbirth, spontaneous abortion, preterm labor, and maternal hypoglycemia. Fetal complications of gestational diabetes are birth injuries related to macrosomia, neonatal hypoglycemia, perinatal asphyxia, congenital abnormalities, intrauterine growth retardation, and neonatal hypocalcemia, polycythemia, and hyperbilirubinemia. Now, another facet of antepartal nursing is providing care for a client who has intrauterine fetal loss. The term for this is abortion, which is referring to the spontaneous or intentional termination of a pregnancy before fetal viability. That is, before the fetus can survive outside the uterus. Most spontaneous abortions occur during the first trimester, sometimes before the woman knows she is pregnant. These are due most often to chromosomal defects or blighted ovum. Other causes of spontaneous abortion are abnormal implantation and maternal disorders such as infection, diabetes, hormonal deficiencies, or cervical incompetence. Signs and symptoms of abortion are vaginal bleeding, abdominal or uterine cramping, low backache, ruptured membranes, and dilation of the cervix. When you care for a client with a threatened abortion, determine the presence of any of these physical findings. Keep in mind that hemorrhage and infection are the most common complications of abortion. Also, be vigilant for signs of disseminated intravascular coagulation, such as hypotension, decreased level of consciousness, reduced urinary output, diminished peripheral pulses, a decreased platelet count, and bleeding. For a client who aborts after 8 to 12 weeks, anticipate that the healthcare provider will perform a dilation and curettage, also called D&C, to remove any remaining products of conception. Remember that your client may experience feelings of loss, so be prepared to provide emotional support for her and her family. Another complication is placenta previa, an abnormal implantation of the placenta in the lower uterine segment, either near or partially or completely covering the cervical os. It is usually detected after the onset of painless vaginal bleeding during the second or third trimester. Placenta previa can be marginal, that is, with the edge of the placenta near the cervical os, partial, where the obstruction of the os is incomplete, or total, with the placenta completely covering the os. The incidence of placenta previa is 1 in about every 200 pregnancies, and it is more likely in women who have uterine scarring, multiple gestation, a history of placenta previa, closely spaced pregnancies, uterine tumors, increased maternal age, or endometritis. Signs and symptoms of placenta previa are painless vaginal bleeding, usually bright red, and recurrent episodes of vaginal bleeding that become increasingly profuse. To confirm placental placement and position, an abdominal ultrasound is done. If your client is hospitalized, she will undergo daily non-stress tests to evaluate fetal well-being. Betamethasone might be given to promote fetal lung maturity if delivery is inevitable. She may also receive blood transfusions and IV replacement fluids, depending on the severity of the anemia from blood loss. Vaginal exams are contraindicated because of the potential for hemorrhage. Monitoring fetal well-being by checking the fetal heart rate and fetal movement is very important. Check bleeding for amount and color. Is it frank? And observe for the onset of labor. If the client will be managed with the conservative measures at home, recommend that she avoid enemas, douching, and sexual intercourse. Complications of placenta previa are hemorrhage, fetal distress or demise related to hypoxia in utero, intrauterine growth retardation, cesarean delivery, preterm birth, premature rupture of membranes, and blood transfusion reactions. Of major concern is abruptio placenta, a life-threatening condition in which the placenta separates from the uterus before the fetus is delivered. Although the incidence is only about 1%, perinatal mortality is about 15%. The most common risk factor is high blood pressure during pregnancy. Others include history of placental abruption, cigarette smoking, alcohol consumption, cocaine use, history of uterine problems, multifetal pregnancies, premature rupture of membranes, folic acid deficiency, a short umbilical cord, and trauma from a motor vehicle accident or direct blow to the abdomen. Abruptio placenta usually occurs during the 3rd trimester and is possible at any time after the 20th week of pregnancy. Signs and symptoms of abruption include severe abdominal or epigastric pain, hypotonic contractions, and a board-like abdomen. Unlike painless placenta previa, abruptio placenta is extremely painful. Bleeding is common, but the amount of vaginal bleeding does not necessarily correlate with the severity of the abruption, since bleeding might be concealed, that is, contained between the uterus and the placenta. Abruptions are graded on a scale from 0 to 3, with a grade 0 considered marginal and a grade 3 severe, with more than 50% detachment and blood loss of more than 500 milliliters. Your interventions will be guided by the severity of the abruption. These include assessing the amount and the character of bleeding, the degree of abdominal rigidity, the degree of abdominal pain, fetal activity and heart tones, and measuring fundal height if concealed bleeding is suspected. Monitor for signs of shock by checking vital signs, urine output, and overall physical assessment. Because of the uncertainty of the situation, you'll offer the client and her family a great deal of emotional support. Be aware that the need for an emergency cesarean section could arise at any time. Your client and her family may fear the loss of mother and baby, so be sure to realize how frightening the situation is and act accordingly. You'll monitor hemoglobin, hematocrit, and coagulation profiles. If emergency delivery is required, your client will have blood typing and cross-matching in case transfusion becomes necessary. Complications of abruptio placenta include severely compromised fetal well-being and sudden detachment of more than 50% of the placenta from the uterine wall